Hey everyone, my name is Vanessa and I'm a second-year physician assistant student working with Heart Women and Girls to answer your questions about sexual and reproductive health. In today's video, we're going to go over your commonly asked questions about birth control. There's a lot of information out there about various birth control methods, and rather than going through all of those with you, I'm going to link you to the greatest, ultimate guide to contraception. It's an infographic that does a really good job of going over the pros, cons, costs, and effectiveness of each method, so be sure to check that out so that you can be a knowledgeable participant in your health moving forward. So now that we've got that covered, what I want to go over with you first is the broad mechanisms of action that these various methods utilize. So we have barrier methods and we have hormonal methods. The barrier methods ultimately work by preventing sperm from entering into the vaginal canal. Examples of these include the condom and internal condom, which are effective if used correctly and consistently every time, aka perfectly every single time, which is hard to do. The diaphragm and sponge are used with something called spermicide, which contains chemicals that stop your sperm from moving. Thus, it can't get through the cervix into the uterus. There are basically two different combinations that these can come in. Either they contain a combination of synthetic estrogen and progestin, or they'll contain just synthetic progestin. Here's a rough sketch to illustrate how hormonal birth control works. It prevents ovulation, so no egg is released from the ovaries. It thins the endometrial lining, the stuff that lines the uterus, making it harder for an egg to implant there. And it thickens the cervical mucus, which prevents sperm from getting through. There's no evidence that long-term use of birth control has long-lasting effects on your ability to get pregnant once you stop. While you're using birth control methods, they prevent pregnancy, but note that when someone taking the pill forgets to take it for a couple days, they can get pregnant that same month. Birth control methods are reversible and do not make it harder to get pregnant in the future. However, getting an STD and leaving it untreated does affect your ability to get pregnant in the future because it can lead to scars on the tube that connects the ovaries to the uterus, thus making it harder for the egg to travel in the right direction. So it's imperative to get tested for STDs and then get treated, which is usually just a short course of antibiotics. If your periods are heavy, irregular, painful, or you have medical conditions such as endometriosis or adenomyosis or epilepsy, then using birth control to make your periods lighter, fewer, or controlling when they start could greatly better your quality of life. Non-contraceptive benefits of birth control can be less painful, more predictable, and lighter periods. They can also clear up acne, decrease risk of some cancers, and protect against iron deficiency anemia. Don't take estrogen-containing birth control if you have had or are prone to blood clots, PEs, DVTs, uncontrolled high blood pressure, if you're a smoker over 35, or if you get migraines. If any of these apply to you, you can still take the progestin-only forms. Side effects from the combination forms can include irregular bleeding, breast tenderness, nausea or vomiting, headaches, and increased risk for DVTs. The progestin-only methods have similar side effects. Be ready for irregular bleeding and potentially ovarian cysts. The depot shot is the only method evidenced to have a relationship with weight gain. Also, be sure to take calcium and vitamin D if you're using this method, because it can lead to reversible bone loss. The copper IUD's most common side effect is increased menstrual flow. All of that being said, remember that you know your body best. So if you're experiencing side effects that you think are related to your birth control, take note of them in your calendar and bring them to your healthcare provider to discuss alternate options. There's a lot of safe and effective methods out there. Just remember to give yourself 3 months. Usually, whenever questions about sexual or reproductive health come up, this question gets thrown into the mix. But you keep those questions coming, and we're going to keep the answers coming.